4, 3, 2. And welcome everyone to this special episode of the Really Is podcast. I am your host, Kevin Edwards. Alongside us today, we have Dinesh Kumar, the Chief Operations Officer, and Amit Vohra, the CEO of Promaxo. Gentlemen, thanks for being with us today.
Pleasure being here as well.
So exponential medicine, what brings you to exponential medicine, and what is Promaxo doing here?
Yeah, I mean, we wanted to be with like-minded people who are making a change in the world, so what's the best place to be at, you know?
Exactly.
Promaxo is impacting the healthcare space by bringing an MRI to an office setting, making an MRI more accessible to the masses, and then enabling live diagnosis and treatment under live MRIs.
Live diagnosis from an MRI. Explain that to me. Conceptualize that.
Yeah, so I mean, currently when you look at MRs, you know, they're big suites. It's patients go in, it's hard to bring in a procedure such as a biopsy or a treatment under MRI because it's expensive, it's just impractical in so many ways from a cost perspective. So by bringing a smaller, cheaper, easily accessible MRI closer to the patients and closer to the providers, we're able to, you know, bridge that gap.
So yeah, MRI is one of the best imaging modalities for diagnosis, screening, and likewise treatment planning. But its use is limited, again, mostly because of poor access. Because you know, if say you go to see a physician and you need to get an MRI scan done, then you'll go to a radiologist or imaging center or hospital to get an MRI scan done, which can take weeks or months to schedule. Then you get it back, and if you're going to do any kind of procedure, it cannot be done under live MR guidance. You have to either do it cognitively or use some other modality like an ultrasound.
So Dinesh, maybe we walk through an example of how your MRI is either replacing the current technology or, like you just mentioned, you can provide to someone who may not be able to pay for an MRI. Maybe walk us through an example to help conceptualize this for our audience.
Do you want to take that, Amit?
Yeah, sure. So I mean, think of a patient coming into a urology practice. Let's say we're looking at prostate cancer as
Prostate cancer. Okay.
you know, as an example. The patient comes in with a high PSA, which is the biomarker that means something is wrong with you. So they come in. The next step is that you're going to go through this invasive ultrasound-guided biopsy, which is a transrectal probe goes up your rectum. You shoot needles.
Fun.
Yeah, I mean, men don't like to talk about it, right? It's as simple as that. But more importantly, the overall yield of the whole procedure is less than 40%. So more often than not, you're not going to find cancer. So now the patient comes back and then they're scheduled for an MRI. Now this patient who doesn't know whether he has prostate cancer or not has to live with that stress of finding out. They're sent over to an imaging center or a hospital. It might take a week, it might take 6 weeks to get the MR scheduled. And now in all that time period, you're still being shuttled around and you don't know whether you have cancer or not. So, and then you come back and then this MRI still cannot be used directly. So you either superimpose it on top of an ultrasound or you do some other procedure. So you can look at the overall convolution of the process. It doesn't work well. That's where we come in and we provide a seamless process where the MRI is available to the physician, the patient comes in with a high PSA, they can get an MRI scan, an MR-guided biopsy right away, and you get to a diagnosis within a couple of days.
Some problems that I would say exponential medicine companies have had coming in is integrating this with just the human beings. Having human beings understand how to use this technology. Are there any problems that Promaxo has run into along the way?
I mean, that's a great question, right? At the end of the day, the adoption is based on human beings, right? It's not based on how great the technology is. What we've tried to do is we've tried to create a value proposition for all stakeholders in the space. When it's a patient, they have a non-invasive protocol, they get instant gratification on diagnosis and treatment. If it's a provider, they have a return on investment model to buy this system, also provide enhanced outcomes to patients much faster, so impacting the overall healthcare costs as well as outcomes. And finally, for payers, you could taking imaging away from inpatient, which is more expensive, and taking it to office and outpatient, which is less expensive and more accessible. So you're basically helping them. So we've been able to work with all these stakeholders over the last 4+ years. And some of these are big investors in us, some of these are big partners of ours, and that's how we've been able to grow to where we are.
And we have been able to get inputs directly from customers from day one. So we have keep them engaged, both from patient side as well. So both of us have background, and we have launched multiple devices in this space as well. So we understand what happens in field right now very well. But on top of that, we also have several specialists in this field, like in robotic surgeons and urologists, who actually are advisors to us as well. So from day one, our value proposition was always, it always had people who will be using it at the heart of it.
What I've both taken from your answers have been that you've been incorporating the stakeholders and not just maybe the shareholders of a company. Many of the organizations that we've come across have found that to be a competitive advantage for them by incorporating all these stakeholders. Maybe explain to our audience the importance of that, as well as what are some of the things that you've learned along the way from your stakeholders in this process?
Yeah, I mean, at the end of the day, if you're in healthcare, you have to impact the patients. If you're not impacting the patients, you're in it for the wrong reason. That's how we look at it. Of course, all of us want to be profitable companies. There's no doubt about it. But if you're not making that impact where the real stakeholder is, and that's the patient, you're not going to be able to do it. So we've learned that from our previous experiences. Even at Promaxo, from day one, it's been all about patients. Then it's about providers. So it's not too big a disruption. Like, we all love to use that word, disruptive technology. We are disruptive, but the problem with disruption is if it's too disruptive, it's just not easily adaptable. So we wanted it to be easily accessible to the providers as well. And finally, you cannot just discount the payers who are paying for this. At the end of the day, they need to make sense out of it. Why should we use this? Why should we pay for this procedure if it's not impacting our population base?
Right.
So, we've learned that if you just look at one stakeholder and not look at the other two, patient is still the foremost, but still, you cannot avoid not working with the others because the whole process tends to become more arduous over the period of time.
Dinesh, I was going to say, what are some limiting factors that you maybe ran into in terms of cost? Like, I want to focus on reaching maybe marginalized communities right now. Are there any things that you've run into, or what excites you most about bringing this technology to these communities?
Well, first of all, we we have worked in this prostate cancer space for a long time, and as we get older, we're getting closer to that point as well. That as you get to 50 years old, then you go through this test called PSA, which is a screening test, only 20% specific, 80 and very sensitive, but it can be high due to a variety of reasons, in prostate. And so we used to go to patient advocacy group as well, and we'd see that people who are just like a couple of years older than us and prostate cancer ran in their families, they would get their prostate taken out just as a precautionary measure so that they could see their daughter graduate. So those kind of things hit pretty hard. And likewise, when we launched first system for which incorporate MRI, again, guidance was still under ultrasound. We would see patients come in with multiple negative biopsies, and with our target biopsy, we'll find cancer, and pretty large cancer in first shot itself. So those kind of things are very illuminating, right? So we don't want to ourselves go through that. It's very personal there. As men, most men, there is incidence rate of prostate cancer is pretty high, but rate of number of people who die from prostate cancer, that rate is relatively low. So it's almost like 1 in 7 or 8 people will get prostate cancer in lifetime, but only 1 in 35 will die from it. Rest die with it of other reasons. So now there are many different questions open up, right? So we don't want to treat people who don't need treatment, but at the same time we want to treat people who need treatment. We want to find them fast so that we don't. Last year we lost 32,000 people to prostate cancer, and that is higher than from year before.
It's shocking, right, what he's bringing. So lung cancer used to be the most commonly diagnosed cancer in men, and even with all the advances, prostate cancer won the race last year. And this is not a race you want to win, right?
No.
There's certain things where you say, okay, winning is not important, and this is one of them. So the impact has to be, instantaneous. You need to be able to get to the right population base. And again, it's hard at times, but overall, we think that we can make an impact.
Well, thank you both for sharing today. I learned a lot. There's a lot to take in as well.
Yeah.
If there's one thing about exponential medicine, it's about breaking down those silos and bringing these people together, especially with technologies and how they can work together. You said it best. Since day one, it's been about the stakeholders. Since day one, it's been about that patient. That takes a lot of leadership. It's going to take a lot of leadership in this field in these next couple of years to break down these silos. So, the last question I have for you is, what is your definition of a real leader?
Yeah, from my definition, a real leader should be somebody who can influence people, but not just influence. They need to be able to execute on the pathway that they really believe in themselves and get people to believe in it as much as they do. So from day one, the whole company has been about making an impact for the real people. So it's great to write like 60 patents and publish those 60 patents. It sounds good on the resume, to be honest, right? Looks good on the website as well. But unless we're able to see it being used on a patient, and unless, you know, that, and we both have seen within us, like between us, we've done over 2,000 procedures that we've seen over our lives. You know, once you see it being used on a patient and you know that patient got impacted by your technology, that's the best, you know, outcome that you can see as a leader, right? So we want each one of our team members to feel that experience. So instead of all of them sitting in the lab and working, we want all of them to go to clinical setting, at least see how their real work is impacting, you know, the healthcare space. So that's how, you know, we're trying to make a change.
I got it. Well, thank you so much for your time again.
Yeah.
For everyone at Promaxo, I'm Kevin Edwards, asking you to go out there, experience your impact, and always keep it real, folks.